And we have some research funding from Integra, but that may be relevant here at the end. So within the peripheral nerves, in the endoneurium, there's this cylindrical basal lamina, and this is critical as like a structural component of the nerve, and it plays a big role in repair. It anchors the Schwann cells, it anchors the axons. This is a cool study that looked at, by Tom Bouchard, that looked at the intravesicular anatomy of the median nerve along different lengths, and you can see how complicated the fascicular anatomy is, and it's not even that it just sits in one spot along, it literally migrates through the nerve. So these are some of the challenges we face in peripheral nerve repair. At the time of injury, you have a couple things happen in the nerve cell body, including this electrical activity, which is something that we're going to talk about later. It's leveraged on as like one of the upcoming technologies that people use. You also have this deprivation of retrograde transport and retrograde transport of new signaling molecules at the immediate time of injury. And then, right after injury, the axons want to grow back to their targets, and if that basal lamina is intact, they'll grow right back to their targets. That's why a crush injury does so well, ultimately, unless it's very far from its target or other factors, but typically the axons will go right back to where they were, unless the basal lamina is disrupted, and then you have this like disorganization, the axons can circle back, and now this is the strategy that we're often seeing. We're having to suture the nerves back together, and the axon, the patients don't recover as well as a crush injury by far, and a lot of that has to do with the basal lamina, whether or not it's intact. Distal to the injury, the Schwann cells, they